Good afternoon, it's Mark Polenkar with another COVID-19 update for Erie County from the Rath Building in downtown Buffalo. Joined by Dr. Gail Burstein, our Commissioner of the Department of Health, as well as Jennifer from Deaf Access Services, who will be providing the American Sign Language for you today. I thank everybody for tuning in, whether it's on Facebook or live on local media, as we continue to give an update on what is happening with regard to the coronavirus COVID-19 outbreak in our community. We have some new information to share with you today. As well as, of course, some of the same things that you've seen, but just updated with the most recent data as of this morning. So, as to be expected, at the beginning of each one of these press briefings, important provisos and reminders that the information is only as valid as when it was put into the presentation, and it may have changed, and often does by the time we get back to our offices and find out that there have been additional cases or, unfortunately, sometimes additional deaths. But we just want people to understand, for the latest information, you can go to our website at www.erie.gov/COVID-19, which has information for businesses, information for daycare providers, information for healthcare providers. I just want to let you know we received brand new guidance from New York State, the Department of Empire State Development, I should say, with regards to essential and non-essential businesses, much more detailed. That will be put on our COVID-19 website there, so that businesses and others can make the determination as to what's essential and what's not, but it just goes to show that it's updated daily with the latest information that we have. Now, an important thing we talked about on Wednesday, and we're going to be talking about going forward, was actually, I should say, announced yesterday, but we've got officially a new testing site that opened this morning on the east side of Buffalo at the Leroy Coles Library on East Delavan near Bailey. And I want to thank so many partners who made this a reality. Of course, our Erie County Department of Health and Dr. Gail Burstein and her team, but of our friends with Kaleida Health who are running this site, Jody LeMayo, their president and CEO, for the work that they did to open this site. Mayor Byron Brown, the Leroy Coles Library is owned by the city of Buffalo, and I want to thank Mayor Brown and his team for the work that they did to allow us to use that facility, as well as Mary Jean Jakubowski and her team at the Buffalo and Erie County Public Library for the work that they did to allow this site to be used. And of course, our friends with Ignite Hope, the African Americans Health Disparity Task Force, in particular Reverends George Nicholas and Kaiser Pointer, who were instrumental in the discussions with regards to opening another site in the 14215 zip code, which has the highest number of cases in the county. So with that, I'd like to turn it over to a video that you can watch from some of our partners with regards to this site.
Every day, I'm thankful to everyone in Buffalo for coming together to protect the health and safety of our community. Since the COVID-19 outbreak, we have updated residents daily on this crisis and have stressed staying at home and physical distancing, all in an effort to help people stay connected while slowing the spread of the virus. In order to begin to return to normal, we need access to more testing in our community. In partnership with Erie County Executive Mark Polenkar, the Erie County Health Department, Erie County Legislature, the Buffalo Common Council, Kaleida, the Buffalo and Erie County Public Library, and the African American Health Disparities Task Force, I'm pleased that we are providing testing in vulnerable neighborhoods. Expanding testing, particularly for residents with the most health challenges, is essential to slowing the spread of the COVID-19 virus and saving lives. Please stay safe and healthy. We are all in this together.
Hi, I'm Pastor George Nicholas. I am encouraged today that Erie County, along with Kaleida Health and the Buffalo Center for Health Equity, is opening up a center for testing right here in our community at the Leroy Coles Library. This collaboration and innovation will serve as a model on how we as a community, the public and private sector, along with community leadership, can effectively address the issue of the social determinants of health, which drive African American health disparities. Today is a day for access. Today is a day where we will get some help in this COVID-19 crisis.
We're thrilled to be able to do this, thrilled to be able to roll this out. As we continue to ramp up, it's our hope to be able to do this throughout our entire community. But what I would say is I really do want to say thank you to County Executive Poloncarz, the Health Disparities Task Force, all in Erie County government who've worked on this, as well as our Mayor Byron Brown. Thank you for working together for something that's really critically important. Let's keep staying together. Let's keep doing things as one so we can solve this COVID crisis. Thanks.
I'm Erie County Chairwoman and Legislator for District 2, April Baskin. And I'd like to thank Erie County, the City of Buffalo, local physicians, the local faith leaders, and of course, Kaleida Health, who all came together to partner to bring a COVID-19 testing site to 1187 East Delavan Avenue. I first submitted my resolution calling for this testing site because East Side neighborhoods are among the poorest in our community, and it's also home to high numbers of essential workers and first responders. The residents in this community also suffer from chronic conditions such as diabetes and heart disease at high rates. Thus, the COVID-19 virus is likely to impact this community. So, the necessity for this testing site at this location is imperative. Thank you to all who made it possible, and I'd like everybody in Erie County to stay healthy and stay safe.
A collaboration between the Erie County Executive Mark Poloncarz, Kaleida Health, and the Buffalo Center for Health Equity has resulted in an additional testing site being opened in the heart of the 14215 zip code. Our gratitude is to the citizens that we serve. We're asking you to continue to stay home, but if you feel symptomatic, make the phone call and drop by the testing site at the Leroy Coles Library on the corner of Delavan and Bailey.
Thank you to our partners. I neglected to mention Chairwoman April Baskin, who is actively involved in the discussions as well. This is exactly what we do in a community as we come together to address a need. The 14215 zip code had the highest number of cases and still does. It had varied also with one of the other zip codes, but when you look at it and what we were seeing with regards to an outbreak on the east side of Buffalo, we felt it was very important to put a testing site on the east side of Buffalo. So I want to thank Kaleida Health for agreeing to open this testing site. As we noted, and as you see on the screen, it's at the Leroy Coles Junior Library at 1187 East Delavan Avenue. The hours of operation are Monday, Wednesday, Friday, 9 a.m. to 1 p.m. And it is for any asymptomatic individual, but testing is by appointment only. Individuals can schedule a test by going online at www.KaleidaHealth, that's KALEIDAHELTH.org, or by calling 859-3222. Prescription from your primary care physician is preferred. However, if you do not have a primary care physician and you're experiencing symptoms, you should still call for an appointment. And that's why it's very important that we test all symptomatic individuals in our community. And I'll turn it over to Dr. Burstein to talk a little bit about why it's very important to have primary care physician.
Thank you. So we know that wellness does start with having a good primary care provider, somebody who knows you, knows your health, knows your family situation, knows whatever situation, and that's your medical home. So for people who have symptoms that are consistent with COVID-19 and they want to get a test and they don't have a primary care provider, we strongly encourage you to get one. We have a list of primary care providers that are accepting patients in the city of Buffalo and around the city of Buffalo throughout Erie County, and we have that on our website, and I believe the testing sites also have that information. So please get connected to a primary care provider, because if you do have symptoms, you really need to discuss this with your primary care provider so you can maximize your management. So so we just want to know that people want to get tested for COVID-19, and we just want to reassure people that we have expanded our criteria in Erie County, so all labs are able to test anybody who has symptoms consistent with COVID-19. So in our public health lab, we are doing a specimen collection by appointment only. And so people have symptoms and they want to get tested, they can call 716-858-2929, and we have a menu of options depending on what your needs are. So if you just have general questions, press option 1. If you have symptoms of COVID-19 and you do have a primary care provider, you'd be prompt to press option 2. If you are ill with COVID-19 symptoms and you do not have a primary care provider, you'll be prompted to press option 3. And if you are a healthcare provider yourself, you press option 4. So it's all spelled out for you when you call that number. And so remember, the whole point of COVID-19 testing is because we want to isolate the people who are infected and remove them from the rest of the community to stop the chain of transmission. So if you are tested for COVID-19 by any laboratory in Erie County, by order of the commissioner, so that's you have to remain in isolation when your specimen is collected. So because you are a suspect now, we don't know if you have COVID-19 or not. You're getting tested because there's a high chance you might. So that's when isolation starts, is you have to be removed from the rest of the community in case you are infectious. And then we have information on our website with what those isolation orders are, and you're supposed to be directed by the either by your primary care doc and or the laboratory that collects your specimen of where to go to get those isolation orders, so you can download them and understand what they mean for you. And if you test negative, then you can go, those orders don't mean anything anymore to you. And if you test positive, we'll call you and explain what you need to do to release yourself for isolation. And remember, anybody that is isolation, whether it just be when you're waiting for your test results or you have to be in isolation for the full course, you are eligible for paid leave under this COVID-19 emergency, either through the New York State Health Department Family Leave Sick Leave Act or through the U.S. Department of Labor. So you can get paid for that time away. So now I want to talk to people about medication safety. So I just want to remind people, even though we wish there were a good medication to treat for COVID-19, we know that there's currently no approved FDA medication or treatments to prevent or cure COVID-19. So remember, any medication you take, we take it for good side effects. However, they all have bad side effects. And if we don't know that a medication definitely will help you, we know that it can hurt you and it can be very, very dangerous. So we really, another reason why you should have a healthcare provider is that you should really talk to your healthcare provider before you take any type of medications to get the best advice. Even if it's over-the-counter medication. As a pediatrician, I've seen kids overdose and even die from, Tylenol ingestion. So remember, every medication can have bad side effects. So as our Surgeon General reminds us, that all Americans, please always talk to your healthcare provider first before administering any treatment or medication to yourself or your loved ones.
Thank you, doctor. I think it's very important that we reiterate that there are no known at-home treatments. There's nothing that you should do. Please do not inject yourself with anything. Do not drink or ingest anything. You talk to your doctor. If you have questions, call us here at the Erie County Department of Health and our COVID-19 hotline at 716-858-2929. But there are no known actual remedies. So don't go out there and just because you saw something on social media from your Aunt Ginny, think that, oh, Aunt Ginny must be right because I love Aunt Ginny. Well, Aunt Ginny might be wrong on this one and it could cost you your life. With that, I'd like to just talk a little bit about cases, deaths, and hospitalizations. As of noon today, there were 2,738 total positive cases in Erie County. We had another increase, I think, of about 67 this morning. 198 people have died. Those are all confirmed cases. There was one additional death this morning after we had some additional ones that we updated the community on last night. There are, of course, no presumed positive cases. These are all confirmed cases, or actually we have a confirmed coronavirus test before the person passes with regards to the individual. We have some good news to talk about with regards to hospitalizations. As of the hospitalization report for April 22nd, we're now 221 individuals that are hospitalized. Of those, 112 were in ICU, and 84 of those had an airway assist. If you go to the next chart, you'll see that we have seen a continual drop in overall hospitalizations. ICUs have stayed pretty much the same with regards to the total amount in the ICU, but we are very pleased to see the reduction in the intubation numbers, the ICU airway assist, without seeing a dramatic increase in deaths, which means it's not just, the drop isn't because we had a tremendous amount of deaths that day. In fact, hospitalizations have declined over the last 4 days. ICU admissions, as we noted, remain stable. And this is the fewest number of ICU airway assists, intubations in Erie County hospitals since April 2nd. So that's a very good sign, and once again, a very good sign that we're seeing stabilization with regards to the ICU numbers and a drop overall of hospitalization. Now, we know the hospitalization can go up or down. That's why we keep a lot of our analysis looking at the ICU numbers and the intubations, because those are the ones that are most at risk of not only having a serious illness, because if they're in the ICU, they have a serious illness, but death. So that is showing us that we're in a good position, or at least better, I should say, maybe not good, but better than we were. We're continuing to track that. This information has been shared with New York State, and I just want to thank all the hospitals and the healthcare workers for the great work that they're doing to protect the individuals in our community. Another good thing that came up in the last few days is, remember, we had about 4 or 5 days in a row of admissions being greater than discharges, and in the last couple days we've had discharges at hospitals being greater than admissions. In fact, it was 2 to 1 on the 22nd of April. There were, I believe, 36 individuals that were discharged from area hospitals as compared to 18 which were admissions, plus those that were in the hospital and converted to a COVID-19 case after test results came in. So that's a good sign that, once again, discharges are greater than admissions, and we hope to see that continue, because if that is the case, that means that people are not only recovering, but less people are going into the hospital in the first place. The next slide is in regards to mortality data by age and gender, and once again, males make up a greater proportion of those who've deceased, and generally it is individuals over the age of 70. If you look at it, it's basically 75% of the individuals who died have been over the age of 70, though other individuals, even going down into the age range of 30 to 39, have unfortunately perished from COVID-19. But once again, these trends that we've seen for the last week or so, with the age range of 70 and above being approximately 3/4 of all the deaths, continue. And once again, I offer my deepest condolences and sympathies to the family and friends of those who've lost a loved one. Actually, I talked to someone yesterday who had lost a father, and it just was, in his words, surreal, because they really can't go through the normal process that you would with regards to of a burial and having a wake, and hopefully that family will be able to get the mourning that it deserves, like every other family deserves to have the mourning when a loved one passes. But unfortunately, these are different times, and it just can't happen at this moment. So once again, we do offer our deepest condolences and sympathies to the loved ones of those who passed. Next slide just shows the previous chart in a bar chart, so it's a little bit more understandable. And you see there, between males and females over the age of 80, they're basically the same amount have died. Though if you look as it pertains to the deaths earlier, you will see now, which wasn't always the case, but you will see now that males, I believe, are greater in every age category. So this just goes to show that this is a disease that can affect any one of the genders, but it seems to affect males a little bit more. We believe because of comorbidity issues and other health issues that males may have compared to females. The mortality data based on race and ethnicity. We continue to see a slight drop with regards to the percentage of those who perish that are people of color, African Americans. At one point, this was approximately 1/3 of all deaths. It's now about 22%, or a little less than 22%. Whites make up about 80% of the population in Erie County, and right now are making up about 75% of the overall deaths. So what we are seeing is it's falling more in line with the population of our community, though it's still off. Still a little less percentage of whites that have perished compared to the general population, and about 7% more African Americans. Latinos make up about 5% of the population, and right now only 1.5% of the fatalities are those who have been identified as Hispanic or Latinos. So we are continuing to watch this. People wonder why we include this data. We've had some say that it's unnecessary. We believe it's necessary because it identifies where there are problem areas. And then we can go and look at where these individuals resided, if they resided in a particular zip code, a particular neighborhood. Are they located in a nursing home? Are they located in a group home? Are they located in an assisted living facility? So it's good to know the age range. It's good to know the issues also associated with race because of comorbidity issues. And as we talk about beforehand in previous conversations, health disparities that unfortunately exist in our community based on race and location. And then the next slide is pretty much similar to what we just talked about based on the population and a comparison of where it is. The COVID map, it is updated daily, a couple times daily with the latest data, which includes, of course, data by town, zip code, overall cases, how many have been tested, as well as deaths. And then in the bottom right-hand corner is a graph which shows the growth in positive cases from our first case back in March to where we are today. And it gives you an idea also of the amount of growth per day. So are we trending upward? Are we trending downward? You see there was pretty good growth in the last 2 to 3 days. A lot of that is directly attributable to the Quest data that we did not have for 5 days, all coming in on one day. And we also are seeing more positive cases because there are more tests being done across our community. And when you have more tests being performed, you're going to get more positive cases. So we are seeing not only greater testing capability across Erie County, but with it more positive cases, which means that's more work for Erie County Department of Health with regard to contact tracing and everything that's associated with that. So it just, this process continues, and as more testing goes online, we just expect that we'll identify more positive cases across our community. And you can keep track of where they are on our COVID map. Erie County responds. We continue to respond to this, including the Erie County Business Task Force. You saw last week or a week and a half ago, we had a presentation from Dottie Gallagher of the Buffalo-Niagara Partnership about what they're doing on the Business Task Force, including the Western New York Business Impact Survey. That closes today. If you have not requested your survey, you need to do it as a business owner by the end of business today. And the link on the screen from the partnership.org is where you go and you make the request for the survey. The only way we're going to be able to properly respond to this and help local businesses is if we hear from you and we find out what your needs are. So please, if you have not completed the survey or not even requested it, please request it by the end of today. A survey will be sent out for you, and then you will have an opportunity to actually participate in the process of how we respond. There's all kinds of information at the COVID-19 pandemic with regards to the business link that the partnership has, just like we have a tremendous amount of information for businesses at our COVID-19 page. Rabies vaccination clinics. I'll turn it over to Doctor, as we have a very sad dog looking on the screen.
So thank you. So we know that rabies is a deadly virus. It's 100% fatal pretty much. And so because of New York State Health Department, New York pause, we can't provide any rabies vaccine clinics because they are not emergency programs. However, if somebody is bitten by an animal, including a bat, that is an emergency, and so we still want you to call us at 716-961-6800 and report that to us, and we will investigate. And if we feel that you or a family member is at risk of exposure to rabies because of a bite or some type of exposure, or you woke up and there was a bat in your room, then we will authorize rabies vaccines. So remember, we all have to work together on rabies because we're not going to be able to have rabies clinics this spring. So you want to make sure that your dogs, cats, and ferrets are up to date with their rabies vaccine schedule. So take them to the vet, make sure that they are up to date with rabies vaccine because it is deadly.
Doctor, that brings up a good point. You do not have to be bitten by a bat. If you see one in your room and you wake up and it's in your room and you don't know what happened during the middle of the night, should you contact the Department of Health?
Yes. Or if
Why?
if you walk into your kid's room, or a room where somebody was unconscious and you see a bat flying in their room, you should call the Department of Health, because when you're asleep, you're unconscious, you don't know if you were bitten by a bat. The bats have very, very small, sharp fangs, and you may not feel it if you had a quick bite, or if somehow saliva from them got onto you. And again, rabies is very contagious, and we just want to make sure that everybody is protected, because it's 100% fatal. So in those instances, we do want you to get a vaccine. And remember, there are no out-of-pocket expenses for people who we authorize a rabies vaccine. Your insurance will be billed, and if whatever your insurance doesn't cover, or if you are uninsured, the county will cover it. So cost is not a barrier to rabies vaccine.
Thank you, Doctor. We have no evidence to show that bats can transmit COVID-19 directly to a human being, but we do know they can transfer rabies. So that's why it's very important that if you see a bat in your room and you wake up, regardless of whether you know if you've been bitten or not, call the Department of Health at 961-6800. Now, another action that's been taken by the Department of Health is regards to property transfers and septic inspections. This is a little known part of the Department of Health, but I'll turn it over to Dr. Burstein to talk a little bit about what's happening here.
Thank you. So we know spring 'tis the season for property transfers and septic inspections. And so we've had to hold off on starting that program again because of the New York State pause. However, we have decided to figure out a way to be able to work around the restrictions and possibly exposing people from COVID-19 by going into people's homes with a plan. So first of all, if there is traditionally been a $150 fee for property transfers, for people who decided to use a private contractor engineer. And under this state of emergency, we are waiving that $150 fee, so to help people who are able to hire a private engineer to do their inspection, they won't incur that additional cost, so try to make it easier for people. Also, we have made a plan. With people who own the properties, we're going to ask them to do a little bit of the work for us on the inside part of the inspection. People who are going to have their homes inspected by us, we will provide you with information and the materials that you need to do the inside portion of the inspection, and then we will stay, our sanitarians will stay outside and do the outside part of the inspection. So we really want to help people make sure that they get those property transfers inspections done, and so we have a plan to take care of that. So what we are doing now is external inspections on property that have public water and with a system that is of record on file. So homeowners that meet that criteria, we will contact you to set up an inspection, so we will call you. And now we are developing a plan that is going to have to be a little bit more complicated to make sure that people who live on property with private wells can get inspected. So we'll be able to launch that next week. Next.
If I could just add before then, we've had a lot of questions regarding campgrounds. The campground order is still in effect, but we believe because of some of the changes we'll be able to do with these sanitarians that we're going to be able to modify it by the middle of next week. So we'll have more information on the campground order, at least for those who permanently reside on a campground or have a location during the summer that would be of permanence. So we hope to have more information on that next week. I'll turn it back to the doctor now.
Sure. So it's one of my favorite weeks, Medical Laboratory Professionals Week. And so during this time of COVID-19, we really want to take everybody involved with laboratory testing so that people who are infected with COVID-19 will know that they are infected and be able to be isolated and not infect anybody else around them. So we want to give a big thanks to laboratory technicians and employees in the Erie County's hospitals, healthcare facilities, academic institution, and especially our own public health lab. Just want to give a shout out to Carlene Pope and everybody else in the public health lab, so thank you.
Thank you to all the medical laboratory professionals out there, whether they're working in our public health lab or one of the other labs locally. They're providing incredible service. They're the ones that are determining whether somebody is COVID-19 positive or not, and I just want to thank them for their tremendous work. We have a great team in our local healthcare workers, just like we have a great team in all the various first line, first essential workers out there. And the essential workers vary from those that are cleaners in hospitals or in the Rath building to our farmers in our farm community, the individuals who are out there growing our food. And you know what? There are farmers in our community who have been growing our food throughout the winter, as they have the greenhouses in the southern part of the county, or our dairy farmers that have been working very hard throughout the winter and of course the spring months, and unfortunately have not been getting the return that they deserve because of some of the dumping of milk that's going on. But I want to give a big shout out to all our first responders in the various forms, but also the essential workers like those in our agricultural community. It really, we would not be able to respond to this without the great work that you all do. With that, I'll turn it over to open up the lines to media so that we can have some question and answer here, and hopefully we'll be able to get people back on their day. With that, I think we started on the bottom last time, so we'll start on the top with Ethan Powers of B News.
Hey, Mark, thanks so much for taking questions today. Yesterday, the governor provided an update on the antibody tests that were conducted statewide, some of which, obviously were conducted at grocery stores in Western New York. The governor said that of the roughly 3,000 tests, about 14% of them came back positive, which could mean that far more New Yorkers have been exposed than previously thought. Have you or Dr. Burstein received any word from the state on how many of the tests conducted here in Western New York were positive and how that data relates to us here?
I have not. I've only been provided the data for the rest of the state, which was very low, but that also includes the Adirondacks, the southern tier, the Mohawk Valley. I do not have it, and I don't believe others do, unless Doc knows.
Nope.
Sorry, Ethan.
Okay, thanks a lot.
Okay, Buffalo News, Aaron Bessaker.
Good afternoon. I just wanted to ask about the increase in testing. We saw the huge spike Wednesday, and then even yesterday, now it's 982 tests, which is far greater than any other previous one day.
But that was not an
increase. Quest stuff, or
yeah, that was the Quest. That was not an increase.
Oh, that was the Quest stuff.
That was not an increase per se in testing. It was the receipt of basically 5 days worth of testing from Quest, 1,000 or so tests. Now we are seeing an increase in testing, but that huge jump, which also resulted in a big jump of positives in that day, was directly attributable to basically 5 days of tests that we should have gotten daily, but we didn't because of a problem on Quest's end. It wasn't sending the test results to the state, and once the state received it, it was transferred to us. So that one day had nothing to do with an increase in testing per se, as it just had with the delay in receiving the results from Quest.
Okay, I mean, that was 1,300 in one day, and actually yesterday, now that number came out, it's 982, which is still almost double any other previous day. Do you know if the Quest stuff lingered into yesterday's results too, or was it just contained on Wednesday?
That was contained on Wednesday. The Thursday,
okay.
Yesterday's was just an overall increase in testing with more sites being available. Stephen Marth, Spectrum News.
Hi, County Executive. Senate Majority Leader Mitch McConnell, suggested Thursday that states that are facing budgetary issues due to COVID-19 should consider filing for bankruptcy, arguing that it's helped some cities and other municipalities in the past. What are your thoughts about New York State, about his comments? If New York State were to potentially file for bankruptcy, how could it impact your?
Well, my initial thought was Mitch McConnell doesn't care about you or I. Erie County went through a tremendous fiscal crisis in the mid-2000s. It's one of the reasons why I was elected comptroller in 2005. Erie County did not go bankrupt at that point, but it was financially in terrible condition. And you don't want to be in a situation where you're filing bankruptcy, because it would require more than just getting rid of some debt on your balance sheet. It would require slashing of jobs. And I was really surprised that Senator McConnell said that, because Kentucky's been hit pretty hard. And by him prohibiting and stopping assistance to state and local governments, he's hurting us. We're going to have to make some difficult decisions if we can't get revenue fillers. New York, and I'm not just talking about money that we receive from New York State, I'm talking about lost sales tax revenue. So for him to basically tell local governments and states to drop dead, file bankruptcy, was ridiculous, because what's going to happen is you're going to see the slashing of jobs and basic services that the public demands. Mitch McConnell may not care about you and I, but I certainly care about you and I care about our frontline workers and our police officers and our firefighters and the corrections officers and the individuals that are there every day providing services to the public, like sanitation workers. There's no requirement that actually governments provide sanitation, but we do, because it's better for all of us. But if we have to slash government because we don't have the ability to pay for our expenditures due to lost revenues, we're all hurt because of it. So I'm glad to hear that President Trump has said that he's willing to discuss a further package to assist state and local governments. I know Senator Chuck Schumer is fighting very hard for it, our senior senator, and it's something that must be done, because if we followed the Mitch McConnell method, we're going to see a decimation of services across the board with state and local governments, and the only people who are going to get hurt the most are the people who rely on those services, as well as the individuals who are laid off, and that's unnecessary and uncalled for. Mike Baggerman, WBEN.
Hey, Mark, there are community leaders on the city's west side that are trying to get a testing site into their community as well. I'm wondering what factors would have to happen for a site like what's at the east side now to also come to the west side, or frankly, other parts of the city of Buffalo.
Well, I do know that there have been tests that have been performed by one practice group, a GBON, I believe out of their west side site on Niagara Street, as well as they are going to be receiving assistance and funds from the Millennium Health Collaborative to provide additional testing. We are always looking at locations, but what we really want to check is see, now we've had enough data, where are the vast majority of these cases coming from? As we've shown, the positive cases, there's much less as a percentage of the population of Latinos and Hispanics, which is often what you would consider the west side of Buffalo, than what you would expect based on their population. And as we've seen, there's a greater amount of African Americans who test positive and have died from COVID-19 than what you would expect from your population. So we look at population trends, we look at locations of where we're finding individuals. We can do analysis and say, as a percentage of the population in a particular region, one area tests higher than another area, and that's just all part of the analysis that goes into a location of where a testing site should go. And as I note, that we do know that GBON, which is based on the west side of Niagara Street, has done some testing in collaboration with Kaleida. And I think it's important for the public to understand that testing has been expanded to many different locations across our region. Right, Dr. Burstein?
That is correct. We know that urgent care centers are offering testing now. We know that we've, through our the collaboration that the county executive talked about in the beginning of this cast, that primary care providers throughout the city of Buffalo are going to be able to offer COVID-19 PCR testing. So testing has expanded, and you can see that with the number of people tested that we release every day. So I think there is more widespread testing available in the community, and hopefully, symptomatic people will seek testing, because we want to find out if you're infected, so we can isolate you and break that chain of transmission.
Thank you, Doctor. Michael Mroziak of WBFO, and I believe Michael just had a big birthday. It was the big 4-0, correct?
Well, you're off by about 10 years, but I'll take it.
Okay, well, I kind of knew that, but I figured I'd throw it out there. Michael, what's your question?
The running joke is, well, the running joke is I officially am as old as dirt. But earlier today, Governor Cuomo, yeah, Well, it was an Earth Day birthday, so there's the joke. Governor Cuomo earlier today suggested that by next week he would make a decision on whether to extend New York pause. How often is he in communication with you? And if he asks you about the situation here in Erie County, what would you recommend?
Well, I am having conversations with the Lieutenant Governor. We talked last night. We shared data again today. The Governor's office has been in touch with me a lot. The Governor and I have texted throughout, phone calls occasionally. But the biggest thing is we've tried to keep his office completely updated with what's going on here. We are not New York City. We've said that for some time. We are also not as good as some other of our peer groups, like we've seen with regards to Pittsburgh and Cleveland areas. However, we have seen a positive number with regards to the hospitalization, such to the point that I made a recommendation to the Governor's office today that hospitals should be considered for potentially doing elective surgeries here in Erie County. We have ample bed supply, and if we did start elective surgeries and it did appear that there was a ramping up of caseloads, we could always just cancel those elective surgeries as they were scheduled. So I think we are seeing positive numbers. If the Governor ended the pause on May 15th, I do not believe he will end it in just one fell swoop. I think it'll be piecemeal. So we're just going to wait and see what the Governor says, and that's why I'm continuing to have conversations with his staff, with the Lieutenant Governor, and it's also one of the reasons, based on the information, the statistical data, why I made a recommendation to the Governor to consider opening elective surgeries in the Erie County hospitals effective next week. Emily Watkins, WGRZ.
Hi, Mr. Polenkars. You mentioned that, the survey for businesses closes today. I'm curious if the survey will provide any results to the public as far as how businesses are currently doing in Erie County. I think a lot of people are wondering how small businesses are doing in the coronavirus economy.
The survey asks all sorts of questions. It is being maintained by the Buffalo-Niagara Partnership. The individual data associated with each respondent will not be shared. That information will be provided to our Erie County Task Force so that we are kept aware of what's needed. It certainly would be ridiculous to ask for a survey and not get the results of it, but we're not going to reveal it on a case-by-case basis, but the task force will have access to it, and we will probably provide some aggregate information to the general public, but that's more than likely less useful than the individual per basis on each business, but we will be keeping track of that.
Okay, thank you.
You're welcome. Marley Tuskus, WIVB.
Yes, hi, County Executive.
Hi.
I'm wondering, we know that WellNow has announced that they are doing testing. No, you don't need to have an appointment. They're doing both direct and antibody testing. I'm wondering, do they differ than the ones that we see in the county's lab? And Dr. Burstein, if you could clarify, because they are not technically a lab, do people still need to be in isolation once they get tested at places such as WellNow?
Yes. If they get the PCR test, yes. Dr. Burstein?
Thank you. Yes. Listen to your county executive. So I can't really speak for the specific type or brand of tests that other providers are using. I know that whichever PCR tests and that any urgent care center or any laboratory is using, that is a diagnostic test. So if you have a positive test from a nose swab, where a PCR test is done, that means you have an active infection of COVID-19, and you have to remain in isolation regardless of where you were tested. Once the specimen is collected, actually that's when isolation begins, because at that point we don't know what the test result will be, positive or negative, and so we have to treat you as if you are positive until you get a negative result. And so that's why we've worked with our urgent care centers, and they should be giving people, where they collect a specimen for the PCR test, the nasal swab information about starting to be in isolation, and the link to our website of where you can download our isolation orders. We also ask them to have paper copies on hand in case people can't get to a website. Now, the antibody test is different. The antibody test is not a diagnostic test. All the antibody test is telling you is that for a person that tests positive for antibodies, it means that they've been exposed to COVID-19 and that they mounted an immune response, and those antibodies are at a level where they're able to be detected by a test. So it does not mean that you have a current infection. It does not mean that, it also does not mean that necessarily that you're immune or protected from future infections. We're not really sure what level of protection that people have, if any, if they have detectable antibodies. So all we can really say right now with confidence is that people have been exposed and likely infected, and they have mounted an antibody response. And so we'll have to wait for science and more experience with infections in the United States and Europe to determine about the protective effect of antibodies, and also if they are protective, how long that protection will last.
Thank you, Doctor. Jeff Russo, WKBW.
Yes, good afternoon, County Executive. I wanted to touch on the child care scholarship from the state for essential workers, if I could. The state has announced that it's reducing now the threshold for that scholarship for child care. How many more families do you see this helping, and should the state reduce the threshold even further, do you think?
I do not know. It's the first time I've heard of that. We have a child care task force. We have a child care task force that's working on those issues, but I can't say I've been actively involved in the child care issue. I've left that up to the Deputy County Executive, Maria White, as well as our Commissioner of Social Services, Marie Cannon, to work with the child care providers, as I've been more involved with the response on the emergency services, the health care, the procurement of the PPPs. I can't answer that question.
Thank you.
Back up to the top, Ethan Powers.
Hey, Mark, thanks. Just a quick follow-up on the antibody facet. Is there any word on the county's order of those tests through Abbott Labs? Have those come in yet?
We are receiving the equipment. We're going to be doing validation tests. We can't say that we're ready to do any testing yet, but I like where we are.
And do you know yet as to how those tests are going to be administered by the county, or is that not yet solidified?
Once we are, let's put it this way, we will announce the way that the tests will be administered, hopefully next week, and at that point we will then be letting the public know exactly how we will be moving ahead with the antibody testing that the county will be doing.
Great, thank you.
Aaron from the Buffalo News.
Yeah, I was wondering if you or anyone in the county has heard anything from state or governor's office in regards to the plans for testing expansion that, the meeting at the White House earlier this week. Is there any way or any specifics on how that's going to play out here?
No. I believe the governor's staff, based on the conversations I've had, are not going to be moving ahead with testing until they know they actually have the additional testing kits and ability to do it. So I think we're really pretty good right now with regards to being able to test individuals who are symptomatic with the original test, the PCR test. So if you're sick, you should be able to get a test from a number of locations, including the Erie County Department of Public Health Lab. The antibody test is there's a lot of discussion about the tests. We get a lot of calls to our hotline for people who want to get the tests, but we're not at that point yet. And I think it's very important for the public to understand that when we have the ability and we are ready at multiple testing sites to do testing, we'll announce it. And until we do, there shouldn't be an assumption that we're doing it, because we're not. Stephen of Spectrum News.
Yes, yesterday the Erie County Comptroller notified the public that the county received $160 million in federal funds from the CARE Act to be used for COVID-19 expenses. Obviously, that cannot be put towards any sales tax revenue losses or cuts in New York State aid. Is that $160 million being used for new equipment that you'll be purchasing, or new items, PPE, things like that, for the COVID battle, or are you kind of using that to help already pay for items that you've already purchased for the for your response?
The CARES Act funding that we did receive yesterday will be put forth everything and anything associated with the response to COVID-19. We're looking at the costs associated with issues and what we've already expended, future costs, including purchasing of testing kits, PPEs, potentially hiring more people if we have to do more testing. Part of the discussion that we recently had on The antibody testing is the individuals that we may need to hire that are specialized in blood drawing to do that type of analysis or testing. So we're going to put it towards everything and anything. We're looking at all the expenditures that we're going to incur to the point of we're trying to make a determination, and we think we might be able to do it with regards to the additional expenses that will result from the governor's order that the Board of Elections in every county sends a absentee ballot application to every individual for the June primary. That's a direct cost that would not have been incurred but for the COVID-19 outbreak. So we're looking at potentially even having the CARES Act reimburse that if need be. $160 million is a lot of money. We basically have until the end of the year to spend it. If we do not spend it under the stipulation, we have to return it to the federal government, and it can only be used for direct costs associated with the response to COVID-19 and the ancillary costs that have resulted from it. And so we're analyzing all that right now, but every penny that we've spent so far, we will reimburse ourselves for every penny, and all the costs that we incur going forward, we will use the CARES Act money for that.
Thank you.
I think Mike Baggerman is next.
Yes. Wanted to get your thoughts on Dan Hokoy leaving ECC. What does that mean for Erie County as a whole, and really how difficult do you think it's going to be to try to find a new president for SUNY Erie during this pandemic?
Well, business continues for a lot of our services. Dr. Hokoy called me last night and let me know that he was leaving for a position in the Kansas City region, and I wished him well. I talked to Chairman Len Lenahan of the Board of Trustees this morning about the process going forward, and I know they're going to have a Board of Trustees meeting soon with regards to a possible hiring of an interim president once Dr. Hokoy leaves. Dan gave me his word he'd be here through July. So that is something that we'll be working on. Thankfully, Dan is not leaving immediately, so he'll still be there leading the college through the next few months. But yes, it is something that we will be dealing with, and I'll be talking with the Board of Trustees and others with regards to the future direction of the college. Michael Mroziak.
I'm all set. Thank you for the birthday wishes. I'm all set, though. Thank you.
Okay. Channel 2, Emily Watkins, anything else?
It's actually
Good on my end. Thank you.
Hello. Hi, can you hear me? It's Kelly from Channel 2.
Hi, Kelly.
Hi. So I have a question about the antibody testing. How will those results weigh into the decision that Lieutenant Governor Hochul will be making, that you'll be talking to her about? And do you know what percentage of the population would have to be tested at this point in order to have good enough data to make that decision, or is there still just so much unknown about the antibody testing at this point in time?
There's a lot unknown, that's for certain. There's a reason why we've ordered 100,000 test kits. That would basically get us through 10% of the population of Erie County, a little bit more than that. I don't think we can get just a small portion of the population, like a few thousand, and have a good idea, because we have to do test kits that are testing based on the entire county. If we tested just people in northern Erie County, it wouldn't give us a good idea of what's happening in the south towns, just like if we just tested the south towns, it wouldn't give us an idea of what's happening in the north towns. Erie County is like a small state. It's about the same size as the state of Rhode Island, geographic, and it's got a population greater than 5 states. So we're going to need some pretty good data to make a determination of where the outbreaks are, where there may be a larger percentage of the population that has it than we thought did. And that's all going to go into the determination of the lifting of the full pause orders. But as I said, I do not see, even if the governor partially lifted the pause orders, I do not see a full lifting of the pause orders anytime soon. And a reminder, if there was a full lifting, we've had good hospitalization numbers recently. We would not have good hospitalization numbers if there was a full lifting of the pause orders. We'd see our hospitalizations shoot through the roof, and we'd see our deaths dramatically rise. One reason why we've gotten to the point where we are today is because we've been following smart social distancing guidelines and following the pause order practices. If we stopped that, I don't care what the antibody tests show, we would see tremendous new hospitalizations and deaths, and that's what we're trying to avoid. Marley Tuskus.
Thank you.
You're welcome. Marley Tuskus. Another question?
Yeah, I'm wondering if yourself and Dr. Burstein were at all surprised by the preliminary data that came out yesterday on antibody testing, or because it was more so focused downstate as opposed to the rest of the state. It's just pretty much unclear at this point.
Well, from my point of view, without actually having hard data with regards to Erie County, it's tough to say. I'm not surprised to see that the estimate was 20% of the population in New York City has it. That didn't surprise me if you just look at the amount of deaths and what they're seeing down there. We're in a battle, a long-term battle. If people think this is going to be over with soon, it's not. Even with the antibody testing, I'll just show you if you're exposed. But over time, more people are going to get exposed. And the more people that get exposed, the better it is for the herd immunity, so to speak. But this is going to continue for a while. And so I don't know what the data shows for Erie County. I don't know how many they actually tested in Erie County. Hopefully we'll get that information from the New York State Department of Health. But when we start doing our own testing, it's going to give us more information, but it's still not going to show. It's probably, I should say, it's going to show that the vast majority of people in Erie County have not been exposed. And that means over time, there's still going to be more people who are exposed. Doctor, did you want to add any more?
Yeah, thanks. Yeah, remember, even if we have a large proportion of the population that have detectable antibodies, we're still not sure what that means in terms of protective immunity. And so we just, still have to keep that in mind. And as the county executive pointed out, we have to continue social distancing as much as possible, even when New York pause is lifted, because remember, what we do today is going to affect the numbers that we see in 1 to 2 weeks, and everything counts. So even when New York pause lifts, we cannot go back to business as usual until COVID-19 is a vaccine preventable disease, and that won't probably be for another year or more.
Thank you, Doctor.
Thank you.
Last question to Jeff Russo, WKBW.
I'm all set, County Exec.
All right.
I'm all set. Thank you very much.
Thanks, Jeff. Thank you all to the members of the media and everyone who's been paying attention as we provide this latest update on COVID-19 in Erie County. Just a reminder, if you have questions, you can always call our COVID-19 hotline at 716-858-2929. That's health-related questions. If you have general questions with regards to service delivery and you live in the city of Buffalo, you can call 311. If you live outside the city of Buffalo, it's 211. I think I got that right. If you always have questions with regards to issues associated with health care, you should call your primary care physician first. If you do not have a primary care physician, you can call the Erie County Department of Health at 716-858-2929. If you're showing the symptoms of COVID-19, you can get tested. You should be tested. You may have it. It's best to know if you have it rather than you don't. Call that number once again, 716-858-2929. We, as we've talked before, will not be having any briefings over the weekend unless, unfortunately, an emergency situation arises. So until I see you again on Monday, may you have a very good weekend. May you be safe. Please continue to follow smart social distancing guidelines. When you go out in public, make sure you have your mask. Put your mask on, wear it in the public, and protect yourself. We put on masks to protect ourselves and to protect others. That's what it's about. It's about being our brothers and sisters' keeper, ensuring that we do the right thing to protect other people and they do the right thing to protect other people. Don't litter, people. I've seen a lot of littering going on. Please don't litter Mother Earth on this Earth Week. And may you have a safe and great weekend, and most importantly, be well all. Take care.